Welcome to the 2023 LACNETS Neuroendocrine Tumor Patient Conference. I'm Kavya Velagapudi, Executive Director of LACNETS.
I'm Lisa Yen, Director of Programs and Outreach for LACNETS.
And I'm Heather Davis, the Associate Director of Advocacy and Outreach at LACNETS. Our annual conference would not be possible without the support of our sponsors. A special thank you to our presenting sponsor, Ipsen, our supporter, Novartis and Advanced Accelerator Applications, our bronze sponsors, Tercera, Crinetics, Curium, and Cameras. Our YouTube channel features approximately 300 net videos. Use our playlists to find webinars on being newly diagnosed, clinical trials, PRRT, symptom management, patient and caregiver stories, liver-directed therapy, and all our annual conference recordings like today's. Follow LACNETS on social media to stay up to date on our upcoming webinars and net news. We are on Facebook, Twitter, and Instagram with the handle @LACNETS. And be sure to add us to your safe sender email list. I'll now pass it back to Kavya.
LACNETS stands for Learn, Advocate, Connect Neuroendocrine Tumor Society. Our name also states the mission of our patient advocacy organization. The LACNETS staff includes Lisa Yen and Heather Davis. The board includes Donna Gavin, who is the sister of LACNETS founder Giovanna Joy Zambesi, and NET patient Mayor Dunleavy, who has been living and thriving with NET for 19 years. LACNETS is supported by a medical advisory council, which consists of distinguished NET experts committed to improving the lives of NET patients. We're excited to share that LACNETS is partnering with the Carcinoid Cancer Foundation, or CCF, to provide more educational content, support, and resources to the NET community. LACNETS is supported by people like you. More than 96% of our donors are NET patients, their family members, and friends. Although we're a global organization, we try to be resourceful and maximize every dollar we receive. Please consider making a donation to LACNETS today at lacnets.org/donate. Now I'll hand it over to Lisa.
Thank you, Kavya. We would like to remind our audience that the LACNETS programs, including today's conference, are created for educational purposes only and do not substitute for medical advice. The views shared in this webinar are the expert's opinion. Please talk to your medical team about your individual care and treatment. Today, you will hear a lot of information. This may be your first conference and it can feel overwhelming, so please take breaks as you need. We also recognize that our educational content focuses mainly on the disease of neuroendocrine cancer. Many of you are tuning in today to learn more about treatments and options. We want to say that you are more than your disease. Our hope is that you will be informed and empowered to navigate your NET journey so that NET does not take over your life and you do not feel that you're defined by your disease. We hope to support you so you can find a way to live richly and fully while living with the disease. I'm pleased to welcome our co-moderators for our 2023 LACNETS Neuroendocrine Tumor Patient Conference. These are key figures in our LACNETS family who have been integrally involved for many years. This is their third year they're serving as co-moderators, and we really appreciate hearing their valuable thoughts and insights. We have Mary Dunleavy, LACNETS board member, wife, mother of 4, including twins, who has been living with neuroendocrine cancer for 18 years. Dr. Andrew Hendefar, medical oncologist and director of the Neuroendocrine Tumor Program at Cedars-Sinai in Los Angeles, and Dr. Dan Lee, medical oncologist and co-director of the Neuroendocrine Tumor Program at City of Hope in Duarte, California. We'd like to start with this important question. What do you think is most important for people to know about neuroendocrine cancer? Mary, let's start with you.
Well, gosh, I would say for me, this is actually a two-part answer. There's kind of a practical side and a psychological side to this one for me. First and foremost is find yourself a NET specialist. This will be discussed probably ad nauseum today, so I won't harp on this too much, but I would venture a guess that there's no veteran NET patient that wouldn't recommend finding a NET specialist as your primary goal. And then psychologically, I would say having NET does not make you a cancer patient. It makes you a person that happens to be living with cancer. So your life may look a little bit different now, but it is still your life. And so don't give up on yourself.
Wow, thank you for sharing that. Dr. Hennefar, let's go to you.
Well, I think what's really important to know is that neuroendocrine tumors are very uncommon and much different from other cancers. And you're not going to understand the disease or get the information that you need from just looking at a web page or a website. So it's so important that you connect with other neuroendocrine tumor patients and advocacy groups such as LACNETS, and you get as much information as you can that way.
Thank you for sharing that. Dr. Lee, what do you think?
So certainly neuroendocrine tumors is a heterogeneous group of tumors. And so what that means is that not two tumors are alike. And any patient that's diagnosed with neuroendocrine tumor has to really be approached in an individual manner. But in the same context, I would say because of the fact that neuroendocrine tumors are so heterogeneous, the providers that you're going to be meeting, as well as the experts that you might seek your care with, are also going to be very individualized. So it's really important to build a trusting relationship with whoever is going to be your team and really take that as an individualized approach, both from a patient perspective, but also be respectful from the provider perspective as well.
Trust is powerful. Well, thank you. As you three know, in 2022, LACNETS rebranded, and it's now the Learn, Advocate, Connect, a Neuroendocrine Tumor Society. Our theme for our 2023 conference is also Learn, Advocate, Connect, which is our mission. So I'm wondering, what does this theme mean to you? Mary, let's start with you.
Well, I'm very proud to be a part of LACNETS and tied to this theme. It's so instrumental, or all three actually have been so instrumental for me throughout my long journey. Each has resonated kind of at different times throughout my 18 years in this cancer process. So learning is obviously an ongoing and never-ending process with NETs and can be very complicated. And I'm so grateful for this conference and for LACNETS, their online library of all things NET. It's so helpful with treatment choices, research, and just connecting with other people. And then the advocacy is so key for so many reasons, to help with early diagnosis, which is a huge issue with NETs, and just greater NET exposure to the medical community. So advocacy is high on the list of important aspects in this. And also the connection piece, I think it took me a while to realize how important that connection piece is. But that emotional support from people who really get it, there's nothing like it. And I'm so grateful for LACNETS for that as well.
Thank you for sharing the patient perspective on this. Dr. Hennefar, what do you think?
Well, I think these are three important themes or ideas for the patients, the providers, their physicians, and that includes also, of course, nurses and all the professionals involved in the care, and as well as family members. So we all have to continuously learn. We have to learn from each other. We also have to teach. We have to advocate for ourselves, for our loved ones, and for our patients and providers. Try to make things better. And I think the most important is the last one, is connecting. We have to connect with each other, care for each other, and work together to make things better.
We're a family. Yeah.
Right.
I appreciate hearing both the patient perspective and the provider perspective. Dr. Lee, I'm curious what you think.
Yeah, I think these three words are really important, as everyone has stated. I think from a learning perspective, it's so important that we continue to learn about this disease as it continues to evolve, because there's always something new that's appearing that can only make us understand the disease better, so that we can provide better care and have better outcomes. I think from an advocating standpoint, this is still a rare disease. And when we're facing a rare disease from both the patient perspective as well as the provider perspective, we need to come together as a team and advocate for each other. And this is really where that connecting piece, the last word, really comes in. that there's no way that we're going to be able to conquer this disease on our own. The only way that we can do this is by connecting with each other. One of my mentors who tragically passed away a couple of years ago, I know what she always said. She said that if you really wanted to accomplish something, if you want to go fast, go alone. But if you want to go far, you actually have to go together. So I really take that to heart and everything. And I think she's absolutely right. We got to connect with each other for us to be able to go far.
Wow, that's a really powerful quote. And it really speaks volumes as to the power of teamwork, of the connection. Well, thank you for that. So in this first section, we're going to discuss what people go through when you're first diagnosed, including basic concepts and talking with a surgeon. So we'd like to welcome our first speakers.
It's my honor to introduce my colleague, Dr. Aman Chauhan, who is a medical oncologist at the University of Miami, and he's going to be discussing with us NETS 101, an overview of NET terminology as well as concepts.
So I'm very pleased and excited to introduce something I think everyone will enjoy quite a bit. It's called A Conversation with 3 Neuroendocrine Tumor Surgeons. This includes Dr. Daniel Anaya, who is a senior member, chief of GI surgery and head of hepatobiliary section in the Department of Gastrointestinal Oncology at Moffitt Cancer Center. We also like to introduce Dr. Calissa Clark, who is a surgical oncologist from the Medical College of Wisconsin. She specializes in hepatopancreatic biliary malignancies. And finally, last but not least, I'd like to introduce Dr. Alexandra Ganji, surgical oncologist at Cedars-Sinai Medical Center, who specializes in neuroendocrine tumors.
I am so honored to introduce Kim's patient story. She is one of the most vibrant and positive fellow NET patients I have had the pleasure of getting to know over the years. As a mom of very young children, her diagnosis was intensely life-altering, and she has a powerful message to share regarding getting second opinions after having started out her NET diagnosis with a very challenging treatment protocol.